Hi everyone! Today our group presents a research about stroke and acupuncture treatment. Stroke. A stroke is a rapid loss of brain functions due to disturbance in the blood supply to the brain. As a result of stroke, the affected area of brain cannot function, causing various neurological damage or complications. The socio-economic impact of stroke is considerable worldwide. It is estimated that there are 4.5 million deaths a year from stroke in the world and over 9 million stroke survivors. Almost 1 in 4 men and nearly 1 in 5 women aged 45 years can expect to have a stroke if they live to their 85th years. 1 year after a stroke, 65% of survivors are functionally independent, stroke comprising a major cause of adult disability. Type of stroke. Firstly, ischemic stroke. It occurs as a result of an obstruction within a blood vessel supplying blood to the brain. Secondly, hemorrhagic stroke. It occurs when a weakened blood vessel ruptures. Thirdly, transient ischemic attack. It is caused by a temporary clot, often called a mini stroke, and these warning signs should be taken very seriously. A variety of causes and risk factors of stroke exist. Important key warning signs of stroke in the beginning stage are face drooping, difficulty in raising both arms, and slur speech. Early calling 000 is crucial for saving the patient's life. Main complications of stroke are changes in physical behavior, communication challenges, changes in emotions and behaviors. Treatment of stroke. Biomedical medicine provides various treatment approaches depending on stroke types and patient conditions. TCM diagnosis of stroke. In Chinese medicine, the underlying pathology leading to a stroke is usually quite complex and includes phlegm, internal wind, and heat, usually occurring against a background of deficiency of qi and blood or of yin. The root cause of stroke is deficiency, mainly the yin deficiency of liver and kidney. Therefore, treatment should focus on regulation and tonification of the liver and kidney. And a combination of acupuncture, herbs, and moxibustion are usually used for treatment. Okay, from now on, let's have a look how acupuncture treatment at specific points positively affects the function of the human brain in the treatment of post-stroke patients by improving 3 aspects of brain mechanism such as blood flow, glucose metabolism, and neurological aspect. Part 1. Cerebral blood flow and stroke. Blood flow and brain function. Cerebral circulation is the movement of blood through the network of cerebral arteries and veins supplying the brain. The rate of the cerebral blood flow in the adult is typically 750 millimeters per minute, representing 15% of the cardiac output. Since the brain is very vulnerable to compromises in its blood supply, the cerebral circulatory system has many safeguards, including auto-regulation of the blood vessels, and the failure of these safeguards can result in a stroke. Blood flow and post-stroke recovery. After stroke, the brain will be either in structural defect or active intervention with rehabilitation procedures. Study 1. Acupuncture for increased cerebral blood flow. Acupuncture was performed at 6 acupuncture points: large intestine 4, 10, 11, 15, 16, and triple energizer 5, which are the points prescribed for relief of spasticity of the affected limb on the weak arms of the patients. The needles were intermittently manipulated and kept in place for 20 minutes. Result. C shows the change in regional cerebral blood flow, which equals B post-acupuncture minus A baseline. F equals E minus D. The techniques SPECT to show the induced change in regional cerebral blood flow from acupuncture-induced subtraction with MRI, core registration, and statistical parametric mapping. Result: focally increased cerebral blood flow was seen in all patients, especially in the hypoperfused zone surrounding the ischemic lesion, the ipsilateral and the contralateral sensorimotor area. Part 2. Brain glucose metabolism and stroke. Brain energy metabolism. Glucose is the primary source of energy. Our body runs on glucose. Glucose is also energy substrate for the brain. Why is glucose so important for the brain? Glucose helps to synthesize neurotransmitters like GABA, glutamate, and acetylcholine. Brain energy metabolism. Even though your brain is only about 2% of your body weight, about 3 pounds, it uses 20 to 30% of the calories you consume. Study 2. Can acupuncture improve the glucose metabolism in the brain of post-stroke patients? Needling at triple-energizer 5. Activate various Brodmann area 13, 19, 30, and 47, and therefore had a regulating effect on the glucose metabolism in cerebral functional areas, and this may relate to its impact on the recovery of post-stroke patients. Part 3. Brain neurology and stroke. There are about 100 billion neurons in the brain. Damage to the brain caused by a stroke can kill neurons outright or slowly starve them of oxygen and nutrients they need to survive. Every minute in which a large vessel ischemic stroke is untreated, the average patient loses 1.9 million neurons, 13.8 billion synapses, and 12 kilometers of axonal fibers. Each hour in which treatment fails to occur, the brain loses as many neurons as it does in almost 3.6 years of normal aging. This emphasizes the human nervous tissue is rapidly lost as stroke progresses, and emergent evaluation and therapy are required. The Wallerian degeneration. It is a process that results when a nerve fiber is cut or crushed and the part of the axon distal to the injury degenerates. Wallerian degeneration of descending fiber tracts after ischemic stroke is a well-known phenomenon reflecting severe fiber tract damage. Study 3. Neurological effect of acupuncture. This study was a RCT conducted looking at effect of acupuncture therapy for postponing Wallerian degeneration of cerebral infarction in 20 patients. The acupuncture group were treated with Sing Nao Pai Chiao method, which includes Spleen 6, PC6, GB16, GB20, and pegging stimulation at GB26 for 2 weeks, 30 minutes every day. Result. Yellow represents the infarction side. Blue represents the normal side. A and B images show the nerve fibers of the same patient. And in B, the rest of the brain tissue was subtracted to highlight the nerve fibers. In acupuncture group, the number of fibers in the infarction area of the patient decreased significantly, and there were less fiber in the lesion than in the normal side. Conclusion. Study results. For blood flow, acupuncture increased regional cerebral blood flow and activated multiple sites in the periphery of the ischemic area or in the hypoperfused zone in the affected vascular territory. For glucose metabolism, acupuncture had a regulating effect on the glucose metabolism in cerebral functional areas, and this may relate to its impact on the recovery of post-stroke patients. In neurological aspect, acupuncture therapy delays Wallerian degeneration of cerebral infarction patients, and it has a potential in assisting the neural repair after stroke. So, conclusion. All these findings certainly underpin the positive and effective role of acupuncture in post-stroke care. However, further researches are necessary for clear understanding of its therapeutic mechanisms. Thank you.